Hi, my name is Millicent Roberts, and I am a patient of Dr. Spence, first time patient. And I've been battling with keloids pretty much half all my life. Since I've been 11 years old, I had a really bad case of chicken pox. So I had scarring all over my body. The ones I had problems with most, the keloids I had problems with most, have been on my face, my chest. I used to have some even in my hair, but they're now just, minimal scars. The ones that we're treating with Dr. Spence today are the ones on my face. I've done different types of therapy to pretty much maintain to at least look a little normal. The one treatment that I have been waiting on for a very, very long time has been the SRT 100. I've researched it. I've actually met some people who actually have done it, and they have been successfully treated with it. I do know it's very nerve-wracking every day, walking around with the scars and being able to, and I have a 5-year-old, so now I'm in the school systems with him all the time, and the kids are looking and asking questions, and it is just really, really a point that I'm trying to make in myself. So doing these treatments with Dr. Spence, I feel like will definitely help me get my body back to where I want it to be. I am truly damaged along the face area, and I believe that after having the surgery, that it's going to look way more beautiful than it did before.
As you see now, we're in the operating room with our patient and she's quite comfortable. These are some sizable keloids on the cheek. Some patients like to have it done under general anesthesia, but most of our patients are quite comfortable having it done as a local anesthetic procedure. We'll begin our procedure shortly, and we'll come back in when we're about midway through, having taken off some of the keloids and beginning the reconstruction. Thank you. We've spent the past 40 minutes getting prepared for the surgery. Oftentimes the skin immediately beside the keloid is intensely scarred, and so this takes a while. The patient is relatively pain-free. Can you tell us, have you had any pain?
I'm not.
Okay, great. So we're going to be doing the excision now. We've prepared everything. We've released all the adjacent skin. We'll be back after we've done the excision and ready for the reconstruction. This is a pretty sizable keloid from the cheek. Base is free of keloids, and we're now going to begin the reconstruction. Welcome back. The patient's reconstruction is now complete. It's important to develop reconstructive techniques that provide for as little tension as possible when we close this. In addition, we want the shortest scar possible. Whatever needs to be done to the tissues underneath is what we do to accomplish this. We're going to complete the opposite side, and then she's going to go to the SRT 100 for simulation today. Thank you. With our patient Millicent. Millicent, can you share with us what your first night was like? She underwent excision yesterday and reconstruction of both cheeks with the removal of rather large keloids. Can you tell us how your night went?
Last night was pretty easy. I think I anticipated like being in excruciating pain, not being able to sleep, and I actually slept the whole night. I actually just got up.
So Millicent is now marked, and she's ready to go through her superficial radiation therapy, and those are the markings on her cheeks. She actually took a peek under the dressings, and you were quite happy with what you saw?
I am after having the keloids on my face, like literally almost 20 years.
Right.
I'm very happy to know they're gone, And I just can't wait till the swelling goes down and to be able to really, really see it. I felt really good, and I've actually had excision done with my keloid several times, and to be honest, this is probably the best I've ever felt, and I'm just being honest.
Good.
Because I've incurred pain before, and like I said, I've anticipated it, but it just has not happened yet. So I'm happy with the results.
We're going to continue to take good care of you. We're going to take you over to the SRT room now, where we're going to proceed with our first treatment of superficial radiation therapy. And if we can get a picture or two out of that, we will for you.
Okay.
All right. Thank you so much, Millicent.
Thank you.
All right. Let's go.